What if the pill you took last night to help you sleep is quietly damaging your brain? Not a dramatic side effect listed on the label. Not something your doctor warned you about. Just a slow, silent interference with the exact chemistry your brain needs to form and keep memories. This is not a rare problem. It is happening right now to millions of seniors over 60, and in many cases, the cognitive decline that looks exactly like early Alzheimer's disease on testing is actually drug-induced, reversible, but only if someone catches it in time. Today, I am going to tell you about 9 popular medications linked to memory loss and cognitive decline. Medications that are sold in every pharmacy, taken by millions of older adults every single day. And I am going to tell you what to ask your doctor or pharmacist about safer alternatives. Let us get into it. Before we begin, one critical point. Do not stop any medication without speaking to your doctor first. The goal of this video is to give you the right questions to bring to your next appointment, not to make changes on your own. Now, the common thread running through most of these medications is a process called anticholinergic activity. These are drugs that block acetylcholine, a neurotransmitter that is absolutely essential for memory, attention, and overall brain function. After 60, your brain becomes significantly more vulnerable to this interference, and many people are taking multiple anticholinergic drugs simultaneously without realizing it. Medication 1. OTC sleep aids containing diphenhydramine. These are the over-the-counter sleep medications found in almost every pharmacy. Diphenhydramine is a powerful anticholinergic drug. It crosses the blood-brain barrier, blocks acetylcholine, and with regular use has been linked to measurable memory problems and increased dementia risk in older adults. Medication 2. Antihistamines for allergies. Many common allergy medications contain the same anticholinergic compounds found in sleep aids. First-generation antihistamines in particular have significant effects on brain function and cognitive performance in seniors. Newer antihistamines generally do not cross the blood-brain barrier in the same way. Ask your pharmacist about the difference. Medication 3. Acid reflux and heartburn medications. Certain proton pump inhibitors and H2 blockers taken regularly for acid reflux have been associated with vitamin B12 depletion and cognitive decline in observational studies. B12 is critical for brain health and nerve function. A deficiency accelerates memory loss and is frequently missed in elderly health evaluations. Medication 4. Certain cholesterol-lowering statins. Some statins that cross the blood-brain barrier have been linked in case reports, and some studies to memory problems and cognitive side effects. Not all statins carry equal risk in this regard. A medication review with your doctor can identify whether your specific statin is one that crosses into brain tissue. Medication 5. Some blood pressure medications. Certain older classes of blood pressure medications, particularly some beta blockers and calcium channel blockers, have been associated with cognitive side effects in some patients over 60. Poorly controlled blood pressure is itself a major risk factor for dementia, so this requires careful discussion with your doctor about the best option for your specific situation. Medication 6. Benzodiazepines for anxiety or sleep. This class includes medications commonly prescribed for anxiety and sleep disorders. Benzodiazepines are among the most well-documented contributors to drug-induced cognitive decline in older adults. Studies show regular use is associated with significantly elevated dementia risk. They also increase fall risk. Yet many seniors have been taking them for years, sometimes decades, without a formal review. Medication 7. Older tricyclic antidepressants. Older antidepressants in the tricyclic class have strong anticholinergic activity. They block acetylcholine aggressively and are directly associated with memory problems and accelerated cognitive decline with long-term use in seniors. Newer antidepressant classes generally carry much lower anticholinergic burden. This is worth discussing with your prescribing doctor. Medication 8. Antipsychotics prescribed off-label for sleep or behavior. Some antipsychotic medications are prescribed off-label to older adults for sleep or behavioral symptoms. These carry significant anticholinergic activity and have additional warnings regarding cognitive and cardiovascular effects in elderly patients. If you or a loved one has been prescribed one of these for sleep or mood management, a medication review is especially important. Medication 9. Bladder medications for overactive bladder. Medications for overactive bladder are among the highest anticholinergic burden drugs prescribed to older adults. Multiple studies have linked regular use of these medications to significantly elevated dementia risk and measurable cognitive decline. The Alzheimer's prevention research community has flagged this class specifically, yet they remain widely prescribed, often without a full discussion of the brain health implications. Now here is the single most overlooked danger in all of this. It is not any one of these medications. It is the cumulative anticholinergic burden. What happens when a senior is taking 2, 3, or 4 of these medications simultaneously? The combined effect on acetylcholine and brain function is dramatically greater than any one drug alone. And the cognitive decline that results can look almost exactly like early Alzheimer's disease on standard testing. This is why a comprehensive medication review with your doctor or pharmacist, reviewing every prescription and every over-the-counter medication together, is one of the most important things you can do for your brain health and dementia prevention after 60. Here is what to do starting this week. Make a complete list of every medication and supplement you take, prescription and over-the-counter. Bring it to your next appointment. Ask specifically, does any of this have anticholinergic activity? Is there a safer alternative for my situation? What is my total anticholinergic burden? These questions take 5 minutes to ask. The answers could protect your brain for the next 20 years. Medication side effects and drug-induced cognitive decline are among the most treatable and most overlooked causes of memory loss in seniors over 60. You deserve to know about them. And now you do. Share this with someone you love who is over 60 and taking multiple medications. Subscribe for honest senior health and brain care information every single week. I will see you in the next one.